All right, and we are back for another episode of Friday Fireside Chat. Today we have Dr. Jane Ruby of Dr. Jane's DC on Twitter, and we're going to talk today a little bit about healthcare. Dr. Jane is a health economist, and so she is a expert on this topic. Welcome, Dr. Jane.
Hi, Alex. Great to be with you tonight. I love
Yeah,
these fireside chats.
yeah. So don't touch the fire; it'll burn you.
Very American. I'm feeling very toasty and warm.
So, obviously, healthcare in the country and in politics has been discussed. We went through this whole iteration of the Affordable Care Act, which a few people in the country seem to be liking, but most of the people in the country don't seem to be liking. So we got President Trump and the Congress got some changes made to I know for me personally that it allowed me to change my insurance provider, and I could get my rates back to what they were pre-Obama. But I'm right in line with a lot of folks that have seen their healthcare rates go up. Mine doubled every year, and until we got the mandate removed, I was doomed to have to pay these outrageous fees. But we now have a new presidential race coming up, and there's a whole slate of Democrat presidential candidates that are talking about what they want to do for health care. And all of them seem to be talking about something.
Well, they're scrambling on the left, that's for sure. But let me start with some basics. We do have a very complicated system. Let me start by saying that Medicaid, first of all, the Affordable Care Act, which is really a misnomer. The Dems are really clever at naming things that makes it sound like you can't argue against it. But the what we call Obamacare is really nothing more than the feds forced states, every state, to blow up their own Medicaid. States administer Medicaid, and the feds put a little bit of money into it. Most the states really put in the majority of the money. So it was really, there was nothing magic about ACA or Obamacare. It was just him forcing the states to blow up their plans. And what I mean by blow up is that even if you were eligible to work and you're healthy, you don't need an excuse, to say, oh, I'm out of work or I'm disabled. It all comers. And so it blew up every state's plan. And that's why, one of the reasons why a lot of states are struggling. But if I could also just give you a quick overview for your viewers, of the American healthcare system, it's really interesting. When people say, are we a single payer? We have Medicaid and that's a socialist program, but yet, we're not trying to be. The bottom line is that we're actually a combination of two programs or two systems. We do have government supplied healthcare, but Medicaid, and it is an entitlement, but Medicaid was developed for the indigent, people who were poor by those definitions back then, people who were disabled, widows, and orphans. That's it. And then we have the second part of government, paid for healthcare is Medicare, which I need to tell you is not an entitlement. Medicare that's why they shouldn't be dipping into it. Medicare is actually a pact between the American worker and the government. It's almost like the government's 401k for people who work. And then the second system we have, and we're very unique in the world, by the way, to have two systems, dual systems. The other side is the private insurance company. That's the term we use. And that's the insurance the health insurance you earn through your employer by working. The concept in the United States is you earn your health care if you're able to do that. So I think once people understand the foundation, the two systems that we work under, we don't want to go to all one system. You remember the little boy who was fighting for his life in the UK? The UK is a strictly, they charge, everybody's income tax is 80 or 90% because the government pays for everything, but they don't manage it very well. And so they didn't have the resources to take care of this little baby, and they were going to put him in hospice. So I just want to say, you don't want the United States to go into a single payer system. Everything gets put into that. And if you've ever, everybody knows that the government is not good at running anything. So you certainly don't want to take away the private insurance. That will force people who are getting their insurance from their employer to go over to a government plan. And that's not going to work very well because the deductibles are so high. And let me just explain that the deductibles are what you have to pay out of your own pocket before your insurance kicks in. So I was having a discussion with a guy who was visiting DC from Europe about a year ago, and we were in a restaurant, and he said, but Dr. Jane, everybody will have health care. They'll have health insurance. And I said, if the deductible is expensive, like 5,000 or 10,000, and they don't use all of that, then they're essentially self-funding. But they have health care, health insurance. I said, no, they don't. If you can't meet your deductible, you really don't have health insurance. So I hope that kind of gives you a good visual of what we have here and why this clamoring on the left for Medicare for all is just a dog whistle for, I'm going to give you a promise for something free, but wait till you find out what it's really going to cost you.
Well, there does seem to be a theme with the Democrat presidential candidates, and I'm going to pull up a screen right now. Um, this was a PBS article, where Democrat presidential candidates stand on healthcare reform. And if you look at the various candidates, Senator Kristen Gillibrand, I want healthcare as a right, not a privilege. Bernie Sanders, healthcare is a human right, or is it not? Cory Booker, even countries that have vast access to publicly offered healthcare still provide private care. Uh, basically the theme is, also Kamala Harris, I believe the solution, and actually feel very strongly about this, is that we need to have Medicare for all. And I think you were just saying that, and that's the bottom line. Peter Buttigieg, take a version of Medicare or something like it and make it available as a public option on the exchange, when this will be a very natural guide path to a single payer environment. So all of them seem to have the same theme. They feel like, and I hate to say, well, actually, I don't hate to say this, but I think it's a very true fact, is that it seems like the Democrats want to buy their way into the White House this year by offering, free stuff. And as a person who has been a businessman and a family of four, and, we've never had any real health issues at our house, you know, part of me says, I don't know what it's like for people that have, chronic health problems and these issues that require them to be very dependent on insurance. But also on the other side of it, you know, we've been healthy for a reason, because we eat right, we exercise, we live healthy lifestyles, and I don't understand why my health insurance costs during the term that Obamacare existed for me literally doubled every year, and I couldn't even get an answer out of the insurance company. They just said because, and I told them see you later, goodbye, and went to one of these health share organizations.
Well, that's because the reason the premium kept going up every year and the deductibles were getting more and more out of reach is because you were paying for everybody in your state, and people that even, it's called universal eligibility. You're eligible if you're breathing, and there's no longer any restrictions on it. And that's not what Medicaid was built for or created for. But let me share a couple of things. I find it really interesting that the Democrats that are trying to race to the White House, who are all over Obamacare and the ACA, and who told us it was so good and that we should really love it and we'll be lucky to have it, are now getting in line to talk about how they want to fix it. So that's kind of automatically acknowledging that it was not a good plan. And Joe Biden did that too. He wants to fix. In fact, it's on his website in terms of his position for healthcare. The major theme, fix the Affordable Care Act. Well, if your buddy Obama was so good at it and you guys were so good at it, what are you fixing? Here's another point I wanted to touch on that you mentioned. This whole issue that they were going back and forth on with regard to whether healthcare is a right. Let me share my opinion on that. I'm a licensed nurse practitioner. I've taken care of probably thousands of people directly, diagnosed them, prescribed for them. I've worked in this healthcare system, and I'm a health economist. I'm published, I've done studies. But here's the point. I'm also a patriot. Let's get the definitions right, and don't let the Democrats twist it. Healthcare is a human right. None of us in our right mind would not take someone into care, or those of us who are providers. When I was clinically active, I've never seen anybody turned down for care. But here's the point. It's not the government's responsibility. It's not a civil right under the Constitution. What does that mean? I mean, the Constitution doesn't say that the government has to provide you a home. The Constitution doesn't say life, liberty, and the pursuit of an equitable income. The Constitution doesn't say, the government has to give you health care. So we were founded on pulling ourselves up by our bootstraps and earning what we needed. So with that said, as a nurse, a healthcare provider, yes, healthcare is a human right, but there are many other ways other than just creating a single, payer system for government to take care of it. Cory Booker, when he talks about private, there are countries that, also have private, healthcare. I have a very close professional associate who lives with his family in Belgrade, Serbia, and they have a socialized medical system. It's a little more effective than the UK, but here's the point. He's a consultant. He does very well financially. I asked him once, we were having a soft argument about, single payer systems, socialized medicine versus what we have in the United States. And I said, he had two small children, toddlers at the time. And I said, where do you take your kids to when they get sick? And he said, oh, we take them to the private hospital. That's where the best doctors are. That's where the best medicines come in. The public hospitals, they're always running out of things. Well, sure, because it's a single payer government run hospital. So it's very interesting, and it's important to think it'll drive that, private insurance thing for the very rich even more than we have now, because what we have now is anybody who gets a full-time job generally has some kind of good health insurance for them and their family. Yeah, so I think I covered your, I think I addressed several of the points that you raised.
I think
And I
that
think,
was kind of a complaint for people in Canada because they have socialized medicine there. And I've heard, numerous stories that the complaint is, I've got a situation, I need to get treatment, and it's just a forever thing with people. And in some cases, it's not even allowed, and you end up going to private physicians.
yeah, I did a lot of market access work in my two previous companies, uh, with our counterparts in Canada. So in my previous companies, we were a global pharma company, and we worked with our colleagues up in Canada for the entire country. And so I had to prepare information for the Canadian authorities that approve the formularies, what drugs are allowed on the formularies for. Of course, they're a single payer government system. And, it's very, very different. And we had to struggle in different ways to get things on the formulary. Many times we couldn't. But to that end, people in Canada, if you find a lump in your neck or your breast, I mean, you're going to wait maybe 3 months, maybe 4 months for that scan. And that's true of many single payer government run healthcare systems in the world. People say, oh, that's a myth and don't believe it. I know the facts. I've worked in those systems. You can believe it. And like I said, in some of our previous conversations, Alex, you don't see people going to the UK for treatment. You don't see them going to Venezuela for treatment. They're from the very rich to the very not, the lower middle class. People come from all over the world to our healthcare facilities because we do have the best healthcare in the world, I believe. And we just need to clean up in terms of, the expense. And we can get into that a little bit too, because I know, I know you probably have some good facts on that. But just remember, we can clean up a lot without, we don't have to throw the baby out with the washwater. We can get people off the dole who can work and earn their healthcare insurance. We can stop having two billing systems. If you have an insurance plan, they charge the insurance company, these physicians, surgeons, hospitals. This is the dirty little secret. They charge the insurance company a much higher rate than if I was private paying. It doesn't mean that it's going to be reasonable or cheaper for me, but they're going to charge them a different rate. We shouldn't have a different rate. The rate should be what it should be for the service or the drug or the medical device provided.
Right. Well, so yeah, that brings me to some of the costs. So if you look at, I've got some stats here. You know, basically, this is a graph that's going, showing healthcare expenditures as a percent of GDP in the United States, and it's just been just a seemingly a never-ending escalation in cost. And we're looking at, and then as compared to the rest of the world, the United States seems to be unusually high. Um, Switzerland, being the closest neighbor, and I guess because they're the kings of social medicine. But my wife, I asked my wife because she's a medical professional. I asked her, so what are some of the issues that you find with the medical with medical costs today, and what I asked what kind of a question should I ask, and it was around the cost. But in her profession, she sees a lot of these different things. So when you look at why medical costs are so high, and of course I'm just saying this as a layman, they have to deal with the fact that they have malpractice insurance they have to deal with. They have to deal with the fact that they've got to go through various steps that the bean pushers push to basically charge up as much stuff to the client that has insurance as they can, and their focus is not so much on health as it is on procedure. And so you see, I've seen, we have a friend that her husband, just came down with an illness, and the doctors misdiagnosed, so to speak, and he came really close to passing. My mother-in-law was misdiagnosed with her lung cancer for a while, and it just seems like they don't have time to focus on patients, and they don't seem to have any kind of incentive when it comes to actually providing the proper services that they need. So they go through the numbers, and if the outcome is good, yay, but if the outcome is bad, then they go through some more numbers. And it's not about focusing on the health of the patient, it's about going through these procedures that prevent the hospital or the doctor's office from being sued for malpractice. And that's unfortunate. So I mean, is that what's causing healthcare costs to go up? Why is the United States the king when it comes to that in the world?
Well, I think your wife has her finger on the pulse of a lot of what's causing it. And so I would say, first of all, in addition to some of those issues that you guys discussed, such as the cost of malpractice insurance, which gets fed back into the costs of physician time and things like that. One of the things that people never talk about is, and I don't begrudge, this is capitalism and this is the United States. I don't begrudge, certain professions making more than others. It's but it should be subject to more to demand. And I do understand that medical education and nursing education is incredibly expensive. But, we've all been subject to physicians waiting in our physician's office where there are tons of people in there and they've actually booked somebody every 5 minutes, which is humanly impossible. And I know this for a fact because when I worked in a hospital as a nurse practitioner, I had a patient. I had to do a physical exam and assess them for anesthesia risk. I needed a good 30 minutes to do a thorough exam, intake, and all that. And I had patients scheduled every 15 minutes. And we all just did the best we could to get through the day. But with that said, physicians don't need to, every 5 minutes, they don't need to you know, make that many appointments so tight, but they justify it because they have costs in other areas. But in terms of administrative costs, here's one thing that you didn't mention. They did a recent study over some of the hospital billing systems where they had an inordinate number of billing clerks. Like at Duke University, they had something like 60 billing clerks. Now, that is a big medical center, but the point is they could streamline those kinds of things because all of those costs get passed back on, to us. I want to touch on one part of that I don't think you did mention, which is drug costs. And President Trump hammers on this because he's trying to get a lot done. Look, I don't mind once a drug is off patent. I have no issue on any chair at this table, whether it's health economist, nurse practitioner, pharmaceutical research, medical affairs person. I don't have any issue, in terms of going to generics as soon as they come available. That's the point. Then the public gets savings. But I want to explain something to people who may not understand the drug development process. And I've been intimately involved in it for almost 20 years. Do you realize that it takes 15 years and $500 million to bring one drug, one molecule from the bench, we call it the bench, the petri dish, to the shelf in your pharmacy office or your pharmacy store? And before people say, oh, cry me a river, drug companies are working on a lot of innovative projects at one time. It's called their pipeline. You can look up any pharma, I guarantee it, a little tab that says our pipeline, and you click on that and you can see what they're developing and what stage it's in. And many of those drugs, they pour millions and millions of dollars into developing them, and many of them don't make it. So when you get 1 or 2 out of 15 that makes it to the shelf, they have to recoup their R&D. And that's one particular argument. Now, by the way, the patent clock doesn't start ticking the minute the FDA approves the drug, by the way, my friends. It starts ticking while the drug is in development. So you might have a 30-year patent. You think, oh, that's ridiculous. They had a 30-year patent. Yeah, well, they ate up maybe 12 to 15 years of it, maybe 17 years in all those stages. There's stages, phase 1 through, there's preclinical, which is animals and petri dishes. And then clinical research is phase 1 to phase 4. Phase 4 is usually post-marketing. That's after launch. So there are many drugs, and so the patent, where I was going with that was the patent life might start somewhere in phase 1, which could be 15 years ago. And then by the time they get an FDA approval, they might have 7, 10, maybe 12 years left. It depends on the drug, depends on all the other legal patent issues around it. So think about that. The companies don't always have that much time to recoup the money lost on, and not lost, but invested in that product.
Well, so okay, so the two things that make it cost is they have to figure out how to make the drug. But then they also need to get through the FDA process.
Correct. And thank you for reminding me that FDA process. While the FDA and the government and the president are bashing pharma about the costs, let me just say that the FDA doesn't do anything for free. If you want, for example, what's called a PDUFA date, and it's an acronym for when you can expect the FDA, is it 6 months or do I get an 8-month decision on my drug, or do I have a year? The FDA has certain time periods. If you want a faster one because your drug needs to get to market, maybe there's no other treatment for this particular type of multiple sclerosis or something, then you pay extra for that short, review period and then you get your PDUFA date and you get that in exchange for the money. But if the FDA comes back and says, look, we looked at all your data, but we don't know if your drug can be taken on an empty stomach because you only did 1 food effect study. We need 2 food effect studies. Well, now the company's got to go back. They've got to go design a study. They've got to submit that study to the FDA to make sure it'll be accepted, the design. And then they've got to conduct the study, right? And they have to negotiate with the FDA on the number. We need an N of, 100. We need 100 subjects. We won't accept data for anything less than 100 subjects. Okay, we'll go and do 100 subjects. So that costs money to execute and negotiate, and then to get the study back out and into review at the FDA. Now you're looking at a year, another year and a half that's eating away at that patent, cha-ching, and you're paying all these fees to the FDA for all the different review processes. So I just don't want people to naively think that, yes, these pharma companies can be very wealthy when they get up there and get big and they get their profits going. But a lot of them fail, and a lot of drugs, a lot of treatments fail. And let me say one other thing about our healthcare system and our pharma system. It's the Gordon Gekko theory. Okay, greed. Mm-hmm. Greed is good to a degree in capitalism because greed fuels innovation. If you've got companies that are competing, looking over each other's shoulders, I want to get there first for multiple sclerosis. I want to get there first for this type of cancer. You've got them really pushing hard and developing the best treatments that are available in the world. I've never seen a new treatment or a cure for something come out of France or England. They don't have the money. They can't do it. They're too busy paying everything for everybody to innovate. So we have the innovation here in the US, and I'm really proud of it.
Well,
Yeah.
so is it
Well,
the
so is it
FDA
the
that's
FDA
costing
that's costing
the drugs
the
companies more
drugs
money?
companies
Because
more
it
money?
seems like in the
Well,
United
Because it
States
seems like
the
in the United
cost is
States
much
the
higher.
cost is much higher.
well, they're definitely. I mean, that is a part. That is a faction of the all the costs that go into our healthcare. And like any other business, pharma is going to crunch numbers. And when they come out with, I've been involved in the development with market access in the development of pricing. And pricing is determined on many different levels. It's not just the crude amount of what did we invest in the drug. So what were all the costs that went into the drug? The FDA asked for extra studies. We had to do another $3 million worth of studies in this particular area. So we add that in. And then we look at the patent life. And then in general, you divide the patent life with the expected number of patients that will be benefited by the treatment, and over, and then you get your, per annum or your monthly costs of the drug. And I'm sure there are a lot of other factors. I'm not a market access from the commercial angle. I'm not a market access expert, but I have contributed, scientific data and health economics information and data to those entities when they were trying to put that into the pie, or the pot, and stir it and figure out what the pricing will be. So a lot of things go into it.
Well, it just seems like the United States just seems to be the most expensive place to have health care, and I wonder if it's because we have the best insurance now to pay for it.
Hmm. I think the insurance companies are a whole separate entity. Remember, they are for profit. And so they actually push back on providers. Providers are hospitals, doctors, nurses, technicians. Those kind pushes back on the billing because and the government, by the way, is the biggest customer of any pharmaceutical company. And but the insurance companies, even the private insurance companies like United Health, Aetna, CVS Caremark, Kaiser Permanente, they will negotiate pricing with a company, especially when a drug is new and the company is very excited to get it on the formulary. If a drug is not on an insurance company's formulary, or if it's not on Medicare's formulary or Medicaid's formulary, and those are two different formularies, by the way, then doctors and nurses, practitioners cannot prescribe it. So it's very important for companies to get their product on these formularies. I myself I've done testimonies before probably every state Medicaid authority in the United States, except over the white space. White space is like states with very little population. And I've done it multiple times. And so it's all to share the information with them so that they have doctors and pharmacists and other healthcare professionals on these state Medicaid panels. Oftentimes they're volunteers in their community. But anyway, they make the decision based on the science, the budget limitations that they have, and all that. So it's very complex. It's not just that, I think we have the most, if we do have the most expensive, healthcare system. And I'm a little cynical because it depends on who you talk to. Which congressional budget office, which entity is doing the analysis. But if we do, it's probably because the quality is so high. But I don't want to say that without also mentioning that we have a long way to go in this country in terms of cleaning out fraud, misuse, waste. If President Trump convened a panel of health economists that are like me, that are former providers, doctors, nurses, billing experts, I think we could come up with a great overall plan for the government programs we do have to get rid of that excess, waste and spend. And you could turn that back into the system to take care of the people that really do need it.
One of the questions that the left keeps referring to when they talk about, the GOP wants to get rid of ACA, and actually I've heard this question asked to folks on the Hill by Fox, is what is the plan the GOP has proposed? Because the GOP really hasn't provided one yet, and I'm just wondering, do you think they're going to provide some kind of a plan, soon?
That's an excellent question, and it's not easy to answer for several reasons. One is that the GOP is not a homogenous unit. Unfortunately, the GOP is a mix of what we often call Republicans in name only rhinos. What does that mean? I've said frequently on Twitter that there is no difference between the establishment GOP and the Democrats. Why do I say that? Because the GOP was in control of the House and the Senate when Obama was president, and he got everything he wanted pushed through. They rolled over and played nice for him. Why is that? Because a lot of them figured out that if they just do everything the Democrats want, we'll fight in public, but behind the scenes, we're all going to get the goodies anyway. And it's really sick and it's sickening. But I believe that that's part of the problem. Now, when you ask, do you think, first of all, I think the GOP should have a huge combination citizen bipartisan politician committee that should have been looking at this a long time ago and start to come up with multiple points for how to develop a new plan or a plan with multiple points in it. The fact that they haven't and they're just sitting there saying, yeah, Obamacare is bad, embarrasses me as a conservative and as a Republican. And I want to see that change. And they have an obligation to do that. Will they do that? Maybe, maybe not, because a lot of these rhinos, these establishment people, are not interested in pushing, pardon the pun, a healthier agenda forward on behalf of President Trump or under his tenure in office. And I think that's a shame. And we have to call them out. We have to primary them out before we get it. So I wanted to lay all that out. I'm not evading the question. It's just very difficult to answer in terms of what they'll do. But they may find it in their interest if they know that we are targeting them to primary them out in this year and in 2020 for those that we can get out in the next two cycles.
Yeah, I think it was Mitch McConnell that was asked most recently, and the way he handled the question was he just says that he's more than happy to have the debate during the presidential campaign, and we just want to wait and see what they have to say. And I think they want to wait until they get, these presidential candidates say what they really really want in a debate type question environment before the GOP actually starts making comment.
Mitch McConnell is, I'm going to say this, I know this is public. Mitch McConnell is the biggest rhino that ever flew on the planet. And he's a phony and he needs to be voted out. Kentucky, my old Kentucky home. I used to live in Covington for 10 years. Love love the whole state of Kentucky. But guys, get your stuff together and get rid of this, dinosaur who's a rhino, an establishment guy who just, he helps the president when it behooves him and he doesn't when it doesn't. So I don't trust anything he says. And it's not, let me get to the comment that he made. It's not about each presidential candidate figuring out what they're going to do. The GOP, on behalf of President Trump's push to get healthcare reform, should be putting something together. They should at least be starting a process to put it together. And anyone who is planning on running on the GOP side for president in 2024, first of all, if they're planning on running to challenge President Trump, A, good luck with that. B, we will annihilate you at the polls. Okay, but so if for those who are thinking about it for 2024, it's incumbent on you to get your own task force and develop a plan that reflects what we the people need. So that's
Right.
my feeling on it, Alex.
Well, it's all very good information. I appreciate you taking the time to talk and share your knowledge and experience. I think this was very good. I think a lot of people need to start thinking about, looking at this problem a lot more deeper because it is a very complicated problem. It's not going to be a simple solution, but we all can agree, I think, at least, within our circles and our side of the political arena, is that what we have or had with ACA was definitely not a good thing, and we need to definitely figure out what to do going forward. So,
Yes, we on the first step of dropping the mandate, for those people who don't know what that meant, that was the penalty, the $500 penalty, that if you didn't get some kind of insurance and buy it on your own through the ACA exchanges or get it through your employer, you had to pay a $500 fine, which actually was cheaper than buying that insurance, which was a waste of money. So President Trump got rid of that mandate. That's step one. But he also had other steps, and he's been held back. I heard him say yesterday that it was about another topic. He said, "My people don't want me to do that." Well, those people, that was about John Kerry violating the Logan Act, which I know is not on topic tonight. But the point is, he still has rhinos, Obama holdovers, and saboteurs that are advising him. And so I'm sure on this particular case, they have said to him, slow down. You got rid of the mandate, just slow down on the rest of the ACA, when in fact he should be pushing harder than ever before. And he should be, getting together. I mean, Mitch McConnell and the GOP should be getting together, a community consensus and put that together for the president. He's going to need it in 2020.
well, yeah, the Democrats were all over Barr about this issue with the constitutionality of the ACA now that the mandate's gone, and basically trying to make him feel guilty about following the law, doing what the president had asked him to do, and representing the United States, and dropping the case in this particular case because they don't want to keep defending something that is unconstitutional. And they were trying to make him feel guilty, like people were going to lose their insurance, and I just think that was kind of inappropriate. But I understand people are concerned, and this is a very complicated thing, and I think we just need to be talking about it more. Especially, I think the GOP needs to actually assure the public that they have a plan, that they're actually working on this, which I don't think they have done a good job at explaining yet.
I wholeheartedly agree on that. And I really enjoyed being on your show. Good luck with it. I think it's going to take off. It's really fun.
Well, cool. Well, we're going to be having our next American Priority Conference. Actually, this year it's going to be an American Priority Festival and Conference at the Trump National Doral in Miami this year. We're going to be talking about a lot of topics. We're going to spend more time on topics, have longer panels. We're also going to have some fun things, fundraisers for St. Jude and Walkaway. We're going to have a Texas Hold'em tournament and a golf tournament to do that, and some other stuff yet to be determined. But it's going to be a lot of fun. It's going to be October 10th through the 12th at the Trump National in Doral. So people want to check it out. It's at AmericanPriority.com. You can look at that. If you got any questions, just hit the contact us button and let us know what we can do for you. But Jane, thanks for your time. You've been a great friend. We've known each other for a long time. You're a true patriot in every sense, and it's been great knowing you, and I look forward to knowing you for a long time. So
Alex, thanks a lot. And tell everybody to check me out on Twitter, Dr. James DC on Twitter.
yeah, Dr. Jane's DC on Twitter. She's got a lot of good information out there. She's tweeting all day long. I don't know how she does it.
Shh.
All right, we'll talk to you
All
next
right.
time.
Have a great night. Great
Bye.
fireside chat. Thank
Bye.
you.